Provo? Sí. Se sent? Prou bé. Bueno. Molt bé. Hello. Good afternoon. My name is Jaime Sabater. I'm the Clinical Applications Trainer of PECO Medical Company from Barcelona, Spain. And now we are making some live demonstrations in our booth in Cosmoprof Bologna Beauty Fair. Okay? In this moment, we are interested in showing you this machine that is called Ultralift HIFU-EVO. That is a machine that pretends to unify in the same machine two techniques that are very, very similar. Okay, one of them, we call it HIFU, the other lipo-HIFU. Okay, the HIFU is already well known in our field because you know it's a transducer, a ultrasound transducer that will generate a thermoablation or thermocoagulation effect on the tissue. We can put several kind of transducers. Each one will deposit the energy in a different layer. So we will see that we can profit this machine to do different things on the face rejuvenation treatments. For body contouring treatments, we will work with another handpiece just to be able to put another transducer, okay? And then we will do exactly the same. That will be an ultrasound in a high frequency, in a continuous way of emission that will generate small wounds on the fat tissue, okay, just to obviously kill the adipocytes and to reduce the contour of this part of the body, for instance, in the abdomen. That's right? Okay, so let's start maybe with this application on body contouring. In the case of Carlota, as you can see, obviously she has just a little bit of excess of fat tissue, but she's very thin, that's right? So the maximum that she has can be what? 1 centimeter depth. It's very, very few. So in the case of Carlota, if we said that she has a maximum of 1 centimeter of fat tissue, it's absolutely illogical to work with this transducer because we will achieve on the muscle and it will hurt. So I have to change it. That's right? Yes? So here we will change the transducer and we will put another one. Okay? That is 8 millimeters depthness. That's right? So here you can see that now we are depositing the thermic effect on this fat layer, more superficial for her, that subcutaneous fat layer, where normally we found the orange pill, the cellulite. That's right? Okay? So now we decided to work with this transducer. So we go here on the screen, we select the transducer that we want, and then the machine asks what energy to use. In the case of Carlota, just to avoid her, okay, any painful feeling, we will work on the minimum energy. That means 35 joules per square centimeter. That's right. In the case of Carlota, I already drew the surface that we are working, because with this transducer we are not only delivering one line of shots, we are delivering 24 lines of 24 mini shots in each one. Okay, so the surface is 16 square centimeters, 4 by 4. Okay, like in every kind of ultrasounds, we have to apply, okay, a very thin contact gel layer to improve, to ensure the transmission, okay? And once we already decided, okay, the energy, the power, we will apply it, okay? We have to be sure that there won't be any air between the surface or the membrane of the transducer and the skin. And here, as you can see, we have the button, okay, to start emitting the ultrasound. Okay? That's right. Let's go, Carlota. Perfect. So I touch firstly here on the screen, I confirm the emission, and I start delivering the energy. It will be 1.5 minutes. So I must be very aware, I must be very careful, and I have to be sure that the transducer will not move up on the skin. Be careful because the contact gel is very jelly, okay, so sometimes we can move it, so we must be very, very careful. That's right. From the moment that the light, okay, is pumping, okay, we stay there. So we need patience. We must take care of not moving it. That's right. I'm not pressing with the handpiece. I'm just putting it, okay, in vertical on the area that I am treating. So I stay there, I wait for this 1.5 minutes, and once the treatment will be finished, the light will stay, okay? Perfect. Okay. After treating, that's right, finished. As you can see here, and as you can see on the machine, there is a beep sound. That's right. As you can see, up on the surface of the skin, there is no redness, okay? No swelling process. Everything is done inside the fat tissue. That's right. So, no problem. So here, same thing. I put some contact gel. Logically, in the case of Carlota, I will stay with the same energy, okay? That's right. I put it like this, and I press the button, okay? I take care of not moving on the surface. And I stay for a while, 90 seconds, okay? So, it's not difficult, it's not tired. So, if I have to advise the client of something, is that when we increase the energy, not in her case, but in other standard or average cases, patients can feel a pinching sensation. That means that we are making those wounds or those mini burns inside the fat tissue layer. But that's normal. It doesn't have to be very, very painful. That's right. Okay, so as you can see here, the light stays pumping, so everything is done. And once again, there has not to be any reaction of redness or swelling. Okay? So, to repeat the treatment here on this area, we should have to wait until 3 weeks, okay? And obviously, after 1.5 weeks, we can start promoting the lymphatic drainage. I should prefer to combine this technique, okay, with shock waves, okay, to impact on this fat layer that now we burnt, okay, to, we could say, to give a chance to the body, okay, to accelerate this process of decomposing, okay, this burned fat layer. Okay, perfect. So after that, we put the handpiece on its support. Okay, we take some paper. We can perfectly clean all the treated area. That's right. And the patient can perfectly make everything that he wants. He can go exercise itself. He can go swimming. He can go having a shower. Everything. He can go working, obviously. That's right. So there is no need, no contraindication, no risk, no problem at all. That's right. And let's suppose that now we delivered many areas. Okay, we treat many areas. But after 40 minutes, the patient will would like to continue in other parts of the body. Maybe it's recommendable, okay, to wait for 1 week and to repeat in those other parts, like hips, like knees, like buttocks, like arms, here on the back side. Any part of the body can be treated with this technique. That's right. Okay, so by the moment, okay, as an abstract, okay, to show you the main part of this lipo HIFU, that could be enough. In some minutes, if you want, you can contact us and we will show you how to treat on the face part, okay, just to make a rejuvenation treatment. That's right. Thank you very much and see you in some minutes. Bye.